Welcome back to our channel. Today, we're going to talk about a topic that might not be the most glamorous, but it's something that affects us all at some point in our lives: diarrhea. What is diarrhea? Diarrhea is a common condition characterized by frequent, loose, and watery bowel movements. It occurs when the digestive system is unable to properly absorb water or nutrients from food, leading to an increase in the volume and frequency of stools. Diarrhea can be caused by various factors such as viral or bacterial infections, food intolerances, medications, or underlying health conditions. It often resolves on its own but can sometimes require medical attention, especially if it persists or is accompanied by other symptoms like dehydration or fever. Types of diarrhea? 1. Acute diarrhea. This type of diarrhea typically lasts for a short duration, usually a few days to a week, and is often caused by infections, such as viruses, bacteria, or parasites. Acute diarrhea can also be triggered by dietary indiscretions or food poisoning. 2. Chronic diarrhea. Chronic diarrhea persists for an extended period, typically more than 4 weeks. It can be caused by underlying health conditions such as irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, celiac disease, or other gastrointestinal disorders. 3. Traveler's diarrhea. Traveler's diarrhea is a specific type of acute diarrhea that occurs when travelers are exposed to contaminated food or water in foreign countries with poor sanitation standards. It is commonly caused by bacterial pathogens such as E. coli, Salmonella, or Campylobacter. 4. Antibiotic-associated diarrhea. Antibiotic-associated diarrhea is a side effect of antibiotic use, occurring when antibiotics disrupt the balance of beneficial bacteria in the gut, allowing harmful bacteria to proliferate. This can lead to diarrhea, often accompanied by symptoms such as abdominal cramps and bloating. 5. Inflammatory diarrhea. Inflammatory diarrhea is characterized by inflammation of the intestines, often due to infections, autoimmune disorders, or inflammatory bowel diseases, IBD, such as Crohn's disease or ulcerative colitis. It typically presents with symptoms such as bloody stools, abdominal pain, and fever. 6. Osmotic diarrhea. Osmotic diarrhea occurs when certain substances, such as poorly absorbed sugars or laxatives, draw water into the intestines, resulting in loose stools. It often resolves when the triggering substance is removed from the diet or discontinued. 7. Secretory diarrhea. Secretory diarrhea occurs when the intestines secrete excess fluid, leading to watery stools. It can be caused by infections, medications, or conditions that affect the regulation of electrolytes and fluid balance in the body. 8. Fatty diarrhea. Fatty diarrhea occurs when the body is unable to properly digest and absorb fats, resulting in oily, greasy stools. It can be a symptom of conditions such as pancreatic insufficiency, celiac disease, or certain gastrointestinal disorders. What are the causes of diarrhea? 1. Viral infections. Viruses such as norovirus, rotavirus, and adenovirus are common causes of infectious diarrhea, particularly in children. These viruses can spread easily through contaminated food, water, or surfaces. 2. Bacterial infections. Bacteria like Escherichia coli, E. coli, Salmonella, Shigella, and Campylobacter are common culprits of bacterial diarrhea. Contaminated food, water, or poor hygiene practices can lead to bacterial infections. 3. Parasitic infections. Parasites like Giardia lamblia and Cryptosporidium can cause diarrhea, especially in regions with poor sanitation. These parasites are typically transmitted through contaminated water or food. 4. Foodborne illnesses. Consuming contaminated food or beverages contaminated with bacteria, viruses, or parasites can lead to food poisoning, resulting in diarrhea. Improper food handling, inadequate cooking, and cross-contamination are common factors contributing to foodborne illnesses. 5. Medications. Certain medications, particularly antibiotics, can disrupt the balance of beneficial bacteria in the gut, leading to antibiotic-associated diarrhea. Other medications, such as laxatives, antacids containing magnesium, and chemotherapy drugs, may also cause diarrhea as a side effect. 6. Food intolerances. Some individuals may experience diarrhea after consuming foods they are intolerant to, such as lactose, found in dairy products, or gluten, found in wheat and other grains, in people with lactose intolerance or celiac disease, respectively. 7. Artificial sweeteners. Sugar substitutes like sorbitol, mannitol, and xylitol, commonly found in sugar-free gums, candies, and diet drinks, can have a laxative effect and lead to diarrhea in sensitive individuals. 8. Inflammatory bowel diseases, IBD. Conditions such as Crohn's disease and ulcerative colitis can cause chronic inflammation of the digestive tract, leading to symptoms like diarrhea, abdominal pain, and bloody stools. 9. Irritable Bowel Syndrome, IBS. IBS is a functional gastrointestinal disorder characterized by abdominal pain, bloating, and changes in bowel habits, including diarrhea. Stress, certain foods, and hormonal changes can trigger IBS symptoms. 10. Malabsorption syndromes. Disorders like celiac disease, lactose intolerance, and pancreatic insufficiency can impair the body's ability to absorb nutrients properly, leading to diarrhea and other gastrointestinal symptoms. 11. Traveler's diarrhea. Traveling to regions with poor sanitation or unfamiliar food and water hygiene standards can increase the risk of traveler's diarrhea. It is often caused by consuming contaminated food or water and can be accompanied by symptoms like abdominal cramps, nausea, and fever. 12. Stress and anxiety. Emotional stress and anxiety can affect gut motility and secretion, leading to diarrhea in some individuals. The gut-brain axis plays a crucial role in regulating bowel function, and stress can exacerbate gastrointestinal symptoms. What are the common symptoms of diarrhea? 1. Frequent bowel movements. Diarrhea is characterized by passing loose or watery stools more frequently than usual. The frequency can vary from person to person. 2. Loose stools. Diarrhea typically results in stools that are loose, watery, and may have an increased volume compared to normal bowel movements. 3. Abdominal cramps. Many people with diarrhea experience abdominal cramps or discomfort, which can range from mild to severe. 4. Bloating and gas. Some individuals may experience bloating, gas, or a feeling of fullness in the abdomen along with diarrhea. 5. Nausea and vomiting. Diarrhea can be accompanied by nausea and vomiting, especially if it is caused by an infection or food poisoning. 6. Fever. Infections that cause diarrhea may be accompanied by a fever, particularly if the body is mounting an immune response to the underlying pathogen. 7. Dehydration. Diarrhea can lead to dehydration due to fluid loss from the body. Symptoms of dehydration may include increased thirst, dry mouth, dark urine, fatigue, and lightheadedness. 8. Weakness and fatigue. Prolonged or severe diarrhea can cause weakness, fatigue, and malaise due to dehydration and loss of electrolytes. 9. Blood or mucus in stools. In some cases, diarrhea may be accompanied by the presence of blood or mucus in the stools, which can indicate underlying inflammation or infection in the gastrointestinal tract. How to diagnose diarrhea? 1. Medical history. Your healthcare provider will begin by asking you questions about your symptoms, such as abdominal pain, fever, or blood in the stools, recent travel history, dietary habits, and any medications you are taking. 2. Physical examination. Your healthcare provider will look for signs of dehydration, abdominal tenderness, or other abnormalities that may provide clues to the underlying cause of your diarrhea. 3. Stool examination. In many cases, your healthcare provider may request a stool sample to test for the presence of infectious agents such as bacteria, viruses, or parasites. Stool tests can help identify the specific organism responsible for your diarrhea and guide appropriate treatment. 4. Blood tests. Blood tests may be ordered to assess for signs of infection, inflammation, or electrolyte imbalances. Elevated white blood cell count or markers of inflammation may indicate an underlying infection or inflammatory condition. 5. Imaging studies. In certain cases, imaging studies such as abdominal ultrasound or CT scan may be recommended to evaluate for structural abnormalities or complications of diarrhea, particularly if symptoms are severe or persistent. 6. Diagnostic procedures. Your healthcare provider may recommend additional diagnostic procedures such as endoscopy or colonoscopy to visualize the gastrointestinal tract and obtain tissue samples for further evaluation. What are the treatments for diarrhea? 1. Fluid replacement. Replacing lost fluids and electrolytes is essential to prevent dehydration. Drink plenty of water, clear broths, oral rehydration solutions, ORS, and electrolyte-rich beverages such as sports drinks or coconut water. 2. Brat diet. The brat diet, consisting of bananas, rice, applesauce, and toast, is often recommended for easing diarrhea. These bland, low-fiber foods are gentle on the stomach and can help firm up stools. 3. Probiotics. Probiotics are beneficial bacteria that can help restore the balance of gut flora and may aid in the treatment of diarrhea, especially if it is caused by antibiotics or infections. Probiotic supplements or probiotic-rich foods like yogurt can be beneficial. 4. Antidiarrheal medications. Antidiarrheal medications such as loperamide, Imodium, or bismuth subsalicylate, Pepto-Bismol, can help reduce the frequency of bowel movements and relieve symptoms. However, these medications should be used with the advice of your doctor. 5. Medications for underlying causes. If diarrhea is caused by bacterial infections, your healthcare provider may prescribe antibiotics to target the specific bacteria responsible. However, antibiotics are not effective for viral or parasitic infections and may worsen diarrhea. 6. Avoidance of trigger foods. Identify and avoid foods that may exacerbate diarrhea, such as spicy, greasy, or high-fiber foods, dairy products, if lactose intolerant, and foods containing artificial sweeteners. 7. Rest and relaxation. Getting plenty of rest and avoiding factors that can irritate the digestive system, such as alcohol, caffeine, and smoking, can help support recovery. 8. Medical evaluation and treatment. If diarrhea persists for more than a few days, is severe, or is accompanied by symptoms such as dehydration, high fever, bloody stools, or persistent abdominal pain, seek medical attention promptly. How to prevent diarrhea. 1. Hand hygiene. Wash your hands thoroughly with soap and water before eating, after using the bathroom, and after handling food. Proper hand washing is one of the most effective ways to prevent the spread of infectious agents that can cause diarrhea. 2. Food safety. Practice safe food handling and preparation techniques to reduce the risk of foodborne illnesses. This includes washing fruits and vegetables thoroughly, cooking meat, poultry, and seafood to the appropriate temperatures. 3. Water safety. Drink clean, safe water to prevent waterborne illnesses. When traveling to areas with poor sanitation, use bottled water or boiled tap water before drinking. Avoid consuming ice cubes made from tap water and be cautious when consuming beverages with ice. 4. Healthy eating habits. Maintain a balanced diet rich in fruits, vegetables, whole grains, and lean proteins to support digestive health. Fiber-rich foods can help regulate bowel movements and prevent constipation. 5. Limit trigger foods. Identify and limit foods that may trigger diarrhea, such as high-fat or spicy foods, dairy products, if lactose intolerant, and foods containing artificial sweeteners or caffeine. 6. Stay hydrated. Drink plenty of fluids throughout the day to stay hydrated. Dehydration can exacerbate diarrhea, so it's important to replenish lost fluids, especially during episodes of diarrhea or in hot weather. 7. Probiotics. Consider incorporating probiotic-rich foods like yogurt or fermented foods into your diet to promote a healthy balance of gut bacteria. Probiotic supplements may also be beneficial, especially during or after antibiotic treatment. 8. Stress management. Practice stress-reducing techniques such as meditation, deep breathing exercises, or regular physical activity. Stress can affect gut health and contribute to digestive problems, including diarrhea. 9. Travel precautions. When traveling to foreign countries, take precautions to avoid travelers' diarrhea. This includes drinking bottled or boiled water, avoiding raw or undercooked foods, and practicing good hand hygiene. 10. Vaccinations. Depending on your destination, consider getting vaccinated against common causes of diarrhea, such as cholera or typhoid fever, before traveling to high-risk areas. Conclusion. While diarrhea might not be the most pleasant topic to discuss, it's essential to understand its causes, symptoms, and how to manage it effectively. By staying hydrated, eating the right foods, and seeking medical help, if necessary, you can navigate through bouts of diarrhea with ease. That's all for today's video. If you found this information helpful, don't forget to give this video a thumbs up and subscribe to our channel for more health tips. Take care, and we'll see you in the next video. Bye for now.